All right, now understanding the symptoms and treatment of ADHD. We are continuing, of course, that our discussion and on attention deficit hyperactivity disorder. And this morning we are joined in studio by Educational Psychologist Dr. Sharon Aitken to talk about how parents can better support their child with this neurodevelopmental disorder, affecting between 2 and 16% of school children. Dr. Sharon, thank you very much for joining us. Lovely to have you in studio, and I'm so happy we're talking about this because it is, I think, such a big deal for parents. But I want to start off with the fact that, you know, when you look at a child, and I've taken a look at my two children as well, my two boys, ADHD, it is very much, you know, you go in and it's diagnosed, but it could also potentially be misdiagnosed. Yes. And there's a lot of reasons for that. You know, a lot of people, maybe teachers out there, could look at a child, the behavior is off, and it could be written down as ADHD. But what should we be looking at to really get it on the mark, to say this is really a case of ADHD?
So first you go broad. You don't want to just follow a Connor's checklist, which is the child ticks all these boxes of ADHD, which are simply behaviors. There are many reasons other than ADHD, which is a specific neurological issue, that can cause the same behaviors. So you can get a child with hearing loss because of sinusitis, adenoids. Just had a case like that. Combined vision and hearing problem can cause ADHD. The child can appear to be the inattentive type.
Just because he's battling.
Yes, he can't or she can't hear or process the information in the classroom, so therefore they must have ADHD. Yeah. You can have you can have other barriers to learning, such as dyslexia, and a whole lot of other things that present, because in the early years, dyslexia, the children make a lot of mistakes, so it looks like ADHD.
But I mean, this is why it's so important to really diagnose it properly after going through all the steps, because you don't want to just place a kid on medication because you suspect, you understand?
And the only time I would consider doing that is when a child is in grade 11 or grade 12, and we've really, but then it needs to be closely monitored. But before that, it should be a broad exploration as to what is actually going on.
Yeah, and this is where it comes down to, from the parent's point of view, is the monitoring of the child once it's been diagnosed. Please outline.
Before, may I say, a parent is their child's case manager, and the parent must trust their instinct. I would rather have this horribly named helicopter parent in my rooms any day than a parent who's inattentive. So a parent is a case manager, and it doesn't matter whether or not a psychiatrist, pediatrician, or whatever has diagnosed your child. You are the case manager because they are busy.
Exactly.
So when
they've got a lot going on.
Exactly. When you notice something is not being addressed, the parent has to do the follow-up, because nobody else has that invested interest.
Yeah, and you are the parents, and you want the best for your child. Dr. Sharon, we're going to be chatting with you in just a minute. Thank you very much. Stay with us as we'll be continuing this discussion in just a little bit. Very important. It's my Feel Good Breakfast Show. Welcome back to your Feel Good Breakfast Show, Expresso, right here on S3. Lovely to be hanging out with you this morning. Now we are continuing our focus on attention deficit hyperactivity disorder, and we are joined in studio by Educational Psychologist Dr. Sharon Aitken to talk about how parents can better support their child with this neurodevelopmental disorder, affecting between 2 and 16% of school children. Now, just to quickly recap, the road to parenting any child is challenging, but the landscape becomes more nuanced when parenting a child diagnosed with attention deficit hyperactivity disorder, otherwise known as ADHD. Now, Educational Psychologist Dr. Sharon once again joins us here for her insight. Dr. Sharon, lovely to be with you this morning. We left our conversation earlier on around the fact that parents are the case workers for their child if it's been correctly diagnosed, and they need to monitor areas such as medication, academics, family dynamics, peer interactions, sports, extramural. Medication, probably the most important. But the thing is, when a parent hears, or now the diagnosis is there, ADHD, especially a parent that doesn't know much about this, you know, it's a first time, a lot of the times they can feel alone, they can feel ill-equipped, they can feel isolated. As a professional in the field, what is your advice to parents specifically when they kind of embark on this journey?
So they really, really do need to upskill themselves. And I mean, not all parents want to go and read the big fat books.
Yeah.
So there are many websites out there. There is Adasa, which is a South African website that they can go and access information from. And there are a multitude of Facebook pages and for different sections of Cape Town. So they can start linking up with people. You know, if you access information through talking, it's much nicer. So they've got to equip themselves to understand the diagnosis itself and what variant their child is experiencing, for want of a better word, and how it is specifically experienced by their child, because each child experiences it differently. Now, it's really important then once the parents have a good handle on what's going on, they need to, using age-appropriate language or getting assistance from a professional, explain the diagnosis to the child so that the child is aware of why they are experiencing these difficulties, because otherwise children label themselves.
Absolutely. And it could be wrong labeled, you know,
and they do
mislabeled.
And they label themselves with horrible things like, I'm stupid, I'm not good enough, I'm a naughty child.
Having that conversations in a child's head is
and you don't
very dangerous. But this is where your work as a professional comes in the field. You know, in what way would you say that parents need to, what do they need to do to assist a child with ADHD? And you mentioned a couple of things, but your role specifically, you know, to be on call for that parent, and it really is for the parent to take that step and say, listen, I need to do this, I need to do this for my child.
So I like them to just get a special book, like with a really nice cover, and maybe the child can decorate it, but it becomes their journey with ADHD. And as difficulties crop up during the different developmental phases, because, sorry parents, I do need to remind you, this is not just a primary school only issue. It's primary school, it's high school, it's young adult, it's tertiary. So
it's
you may
job. Yeah. It carries on. It's a journey, like you said.
It's a journey. So you have one of these books, and in the books, as you notice issues creeping in, you can make a note of it. And then you should hopefully have a professional team who assists you. This sounds very expensive, but it's actually not really very expensive because you don't see them that often. So a lot of my parents who have children with ADHD, and a lot of my parents with ADHD, they will come in and they will see me maybe once every 6 months. We just see what's happening, what do we need to tweak, how do we go forward? How can we, so for example, how do we move from a parent monitoring exceptionally closely with beautiful lists and things up on the walls and routines, schedules, consistency, exercise. How do we move from the very close micromanaging of that in primary school to a less sort of micromanagement? But I have to warn you, grade 8 and grade 9, you need to have your wits.
Hands-on.
Yeah, still very hands-on. By the time we're getting to grades 10, 11, and 12, we can be backing off and supervising once a week. Same with varsity. First job, you know, but they need coaching on all of those different. There's no need to reinvent the wheel.
There's no need to reinvent the wheel, but I think the takeaway points for the discussion this morning is make sure that you get the right diagnosis, first and foremost. Educate yourself as a parent and share that education and experience with your child, I'm sure, and work with a professional like yourself.
And if you don't think the medication is working, please do not take 6 months to alert somebody. Then you get hold of your ed psych or whoever and you let them know immediately, because then they can get hold of the psychiatrist.
Yeah. Dr. Sharon, thank you very much for joining us this morning. I wish we had more time, but valuable advice this morning for you parents.